I am Dr. Baptiste and I produce various types of videos ranging from health videos to videos about portfolio careers and general practice. In this episode, we will be hearing from Dr. Lavan, an established GP who works both as an NHS GP partner at 2 practices and a private GP at Harley Street, among other roles. The focus of this episode is working in the private sector and how you can get started. If you like this video and want to see more, then stick around, subscribe to the channel, give it a thumbs up and share it with a friend.
Hi everyone, I'm Dr. Lavan. I'm a GP. I'm based in South London and I run 2 NHS practices. But my main hobbies now, if you could call it hobbies, is actually special interest in various areas in medicine, particularly diabetes and also ADHD. And more recently, I've got into the world of social media and also private care. And really today, our topic is mainly around private care and really how we can inspire some of our new upcoming GPs and just doctors generally, rather than unfortunately the move of jumping ship to Australia, Dubai and Canada and places like that, how we can find fulfillment in our career choices and actually setting up potentially privately in London or somewhere abouts in England to try and do things where we can still continue to help for our patients who are seeking other options, where they want to spend good quality time with their doctor, looking for a kind of holistic approach, but also using that time, that spare time that we can make for ourselves through private care to hone in on other specialities, maybe a subject you've been really interested in, minor surgery, menopause, and then focus on trainings to set up special interest in that to potentially add that on as an extra to your normal care where you're providing as potentially a private GP, but also the special interest where you'll get a lot of good demand. So a lot of the time, I get a lot of questions on how I got into private care and private medicine. It is a minefield. It's a scary place. And I think one of the first bits of advice I'd tell anyone is you need to become skilled up. You need to become confident in what you do. The worst thing you could have is being in front of someone who's traveled from abroad or someone who's come from very far across the country to see, or even seen you virtually. Keen and excited in a lot of cases to meet you and want you to really look after them holistically. And you have doubts and doubts in the sense of you could be a wonderful clinician, but doubting yourself. So I don't want this to turn into kind of a wishy-washy wellness, mindfulness thing, but actually having confidence in yourself is very, very crucial, because you can imagine some of the signs that patients pick up on if they feel you're doubting, or if you're not sure, that you don't show that you don't have a way to reach out. So a lot of the time when I don't know a question or it's something quite advanced, I have got friends, who are working either privately or in the NHS in neurology or radiology or anesthetics, that I quickly assure the patient, I can get in touch with and get that information for. So it's important to be truthful, but also to show confidence. I got to a stage where when I finished general practice training, I was very keen and hungry to just become the best person I could. I never wanted to be in a situation where I'd be questioned on a topic and I didn't have an idea about it. I always want to feel I have an idea. And as you'll know, being doctors, reading is a large part of our job, and teaching, constantly learning is important. So I felt after, all my training and my 10 years as being a partner, I really felt comfortable in my role as a primary care clinician. I guess once you're in a position where you've maybe been in the NHS game for a while, so I've been doing NHS for a decade. I've been a partner since 2013, a GP partner. I worked in so many areas, doing locums. Even when I was a partner, I quite enjoyed going to other areas, just learning how things are done. So, going to a place like Southampton to do extra work, Kent, Margate. So by that stage, I said, yep, it's about time. And you start to get a following. Obviously, many of you who'll know who are lucky enough to be in a practice which is very community-based, you get a following, a true privilege to be a GP and to be a family doctor for these patients who really do rely on you in all manners. I've had cases where, patients would ask me to be their delivery suite. And I say, you've got to get the husband there first, but they're kind of keen for you to be there. So a real privilege to be in that area. But these are all learning experiences, and it gives you confidence that, look, maybe I'm doing something right. And if I've got weaknesses, for example, psychiatry, I need to skill up on that and become better. diabetes, for example, was a weakness. And I knew if I were to go into private medicine, I'd probably be questioned on that as well. So I skilled up in diabetes to the point now I enjoy speaking with AstraZeneca and Novo Nordisk, some of the drug companies, talking for them on certain diabetes areas, because when you really learn and enjoy the subjects, and when you really understand something, you do begin to enjoy those subjects. So I got into a position where, yeah, it was kind of COVID was hitting, and I thought it's time to think of things differently. I never wanted to give up my two NHS practices, but I thought, no, I want to, spread my wings a bit and then look into private care, because a lot of my patients, sadly, they wanted to see me in my NHS practices. As much as we try to get them seen in our practices as quick as possible, sometimes with the wait times, it's difficult even to see us. And they'd always offer, they're kind of that typical history where they sit with you over the first few years, and then as they become well-to-do, they kind of move out to the outskirts, but they still want to maintain. And we sometimes try to keep them on our list, but it is tricky. So they said, could we see you privately? Where are you going to be based? And so I started looking into it. And then the journey, I think the key points to take is, after the building of your own confidence, skilling up as best as you can, is try to make life easier, because you can't do everything when it comes to setting up privately. You can't set up the bank, the CQC registration, the building. There's a lot to do here, the branding, there's so much. So you do need to delegate. So I'm not saying you have to have a massive pot of money, but probably having a few £1,000s there just for the initial setup is definitely worthwhile. The biggest and most useful cost I found was actually paying a company to do the CQC registration aspect. That's a massive part. You cannot practice, going on home visits, seeing at a base. You can't go and see these patients privately if you're not CQC registered. I had a phenomenal lady. She was wonderful, kind of chucked all my information, kind of interviewed me for about 20 minutes about what my vision was, what my plans, how we wanted to set up. And she literally writes it all up for you, fills out the forms, which are a bit of a headache. And actually gave me a mock interview as well, which was lovely, and stuff that I just wouldn't expect. Challenging situation. If you went on a home visit, who's going to be there to know that you arrived safely? Something that I didn't even think of. And I was, I should get my wife on board. So every time I leave to go to a home visit privately, I should inform my wife and message, I'm going to this address. We'll be back after this time. Simple things that it doesn't probably cross your mind. So definitely getting someone employed for that. And of course, where you're going to be based, that's really important. Respectfully, if you're going to be in London or a very busy area where there's going to be competitors, are they really going to go for you? And we have to be honest, if you're just starting up, why would they go for you? So I did initially set up in Harley Street, just because you can imagine the branding of that, saying you're a doctor at Harley Street makes a difference. So at the base where I'm at, number 10, they give you a short interview. They just make sure everything's kind of tick boxed, and then you can set up there. And that's quite good in terms of networking, because obviously there's a dentist now in touch with me, and then some of our colleagues down on Harley Street are now reaching out saying, we could do some collaboration. So that was one part of it, because I knew there would be patients that would like to see me in London. But the other thing is in your local area, do you want to be accessible? You need to decide, do you want to be that 24-hour doctor that, potentially where the patients pay a subscription every month, but you are there in their beck and call? I didn't want to be there. And if I ever wanted to be that, I wanted to make sure I was in a team. But there are different models. You could set up a subscription model where actually they pay per month, a small fee, but that means they have access to you literally all the time. So you've got to be mindful. Or do you set limits? Or is it just a pay as you go? You are there when they need, in terms of they can book in, you set up appointments, or they can speak to your PA and book in a time convenient for you. So really have an idea of what you want to do in the future. But then branding becomes important, putting on social media. Is that what you want to do? I was quite careful where I was fortunate. I had a good following of patients that I didn't need to advertise. If I advertised, I probably would have struggled to see those patients. And I didn't want to, my persona or my view on social media is obviously that NHS doctor, that helpful. I know some people find it difficult to accept NHS doctors going into the private care, but I think that's another thing that just needs to be removed. I was very reluctant to go into private care. I think I would have gone in probably 3-4 years earlier, but it was this idea that, you work for the NHS, you starve for the NHS, you don't drink water for the NHS, you don't go to the bathroom, and it's, and we have to get out of that. Sadly, it doesn't pay mortgages, it doesn't pay well or fairly. We've got to do the best for that. So actually we can support the NHS and do other side hustles, as it were, or other projects to compensate. But the bottom line is it doesn't fully support, and therefore don't feel guilty when you make that move to private. I think one thing is people kind of turn their heads and said, "Oh, Lavan, you're going to the dark side," or well, I at one point I ignored it because I said, "Look, at the end of the day, I want to have a fulfilled life. I want to give time for my kids. I want to," and some of the mentors I had who I'd spoken to, they have a fabulous life, and they're still looking after patients. And remember, just because you're a patient who's paying and you're private doesn't mean you don't deserve care. There are good people I serve privately, truly wonderful people who are so appreciative of your time, so appreciative of every word that comes out of your mouth, every investigation you challenge them with, or every vitamin advice you give them. So grateful that I say, well, they're just as equal as patients as an NHS, and you're valued for your time. They really, value. And I think for me, the biggest shock was when I was doing my NHS approach of follow-up, saying, I'll call you for free or email you next week. They said, can we just not catch up? And I'd say, oh gosh, but and they say, oh, don't worry about the payment. But they really value, and it's so refreshing because I've been 10 years working in the NHS as a GP partner, where slowly there was that degradation in quality of how we're perceived. And this was quite refreshing. So yeah, think about yourself, become confident, get up skills, get someone to do your CQC application to support, get you through. And that was a bit marginally stressful. The CQC then interview you, they look at the room, they look at your process of getting rid of waste, emergency equipment, and just how you are. Are you genuine? Are you going to be safe? They ask you questions. So it's a little bit marginally stressful, but you're well prepared. And then you get your CQC, which is quite nice, getting the certificate approved. You can practice now. And just, making sure what you want to do. Is it going to be a base? Is it going to be online? Is it going to be a home visiting service? And then from there, would you be doing kind of a group practice, single practice, subscription? There's a lot there that you need to probably think of, but think about that before you step into this world. And then my final point is, now I'm in a different position where I've been doing this for 2-3 years. I'm fortunate where I work with child psychiatrists and we do ADHD work together. I do is stable follow-ups. And that obviously brings in a lot of general practice patients, because I see the kids for their ADHD, for their follow-up stability. And then the parents will ask, oh, do you see patients privately for general health? And of course, yeah, absolutely. So that's been quite helpful for me. But I realize now that it can be a very lonely place, private medicine on your own. So when I troop up to Harley Street once every couple of weeks, I'll book a few patients in. I'll go in and it's lovely. I really enjoy the kind of room, the environment, the trip up to London, having a coffee. That whole vibe is lovely, but it is quite lonely. It's just you in the room. In my partnership, I've got very young partners. I'm 40. I've got my 2 younger partners who are a couple of years younger. And it's nice buzz, and the management are lovely. You can go up and have a chat and we're laughing. And whereas this is just you. And there is a partial thing there where you feel a bit isolated. So just of late, I've decided to kind of join forces with a couple of new guys and form a bit of a team. And the idea now is to almost set up a subscription service where actually we are here for you. So actually, if I'm away, it's okay. Actually, I've got good colleagues and we're partners together in this to do, health checks and things like that. But I think now that would be the next step for me. And then from there, if you guys are already on that journey, thinking about a special interest, can you do annual reviews? Can you do these Wellman checks or well-woman checks, do the full whack X-rays, ECGs, because there's loads of companies available out there who will come and provide equipment for you to take to patients or to your base. So a lot there to digest, but yeah, in that order, I think there's a few points there to get your head around and really to vision what you want in private care. Because actually, if you're enjoying your partnership, if you're enjoying your salary, if you're enjoying your locum, jumping around doing a special interest, you may argue, what's the point? But there is definitely a confidence building there and some opportunities that do arise from private medicine. So to summarize, I'd say the big point is, if you're thinking about going to private medicine, especially general practice, the number one thing I'd say is have a vision. So have an idea of what you want to do, whether it's a special interest or home visiting service or being at a base. Then getting your CQC registration, how are you going to go about doing that? Are you going to get a team to do that, or are you going to do it yourself? And my advice would be to get a team who will do that and reduce that stress for you to support. And the third thing is whether you are going to have a base, whether it's going to be going from your home and doing home visiting service, or actually have a base in your local area, or renting a space, maybe say in one of the nice places in London. And then finally, I would say, going forward, what would be your vision? Would we create something where there's a subscription service? Because once you're settled, you may find actually this model is quite slow moving, or it's overwhelming, and you may have to adapt to it. So is it something where you're going to have a subscription model where patients pay per month and they can see you for a certain number of times in that month, or would it be a pay-as-you-go? Thank you for the opportunity, Patrice. So I guess from my side, one of my biggest passions is to inspire colleagues. A lot of my time when I was going through my medical journey, when I said, I wanted to do a partnership or 2 partnerships or 3 partnerships, they say, well, that's impossible, you can't do, or having a special interest in more than one place, oh, you can't do that, or working with drug companies, oh, you can't do that. I think for me, the biggest journey and learning for me is you can literally do anything you want. There's so many opportunities out there, and try and take everything. You don't have to do it for 5, 7, 10 years. You could do it for a period of 6 months to a year and learn from it. So I've been very fortunate to kind of sit on leadership roles, federation models that sit in boroughs. And obviously with the primary care networks that came through, I was fortunate to be a clinical director in that. But then, yes, special interests, pharmaceuticals, you can work for AstraZeneca, you can do talks for them, you can set up clinics, ADHD clinics, you can set up chronic kidney disease clinics that are funded by pharmaceutical companies. So lots out there that you should do, as well as special interests. When they say, oh, you can't do this because you can't do a urology special interest, well, of course you can do it. You can set something up. You can even go and meet consultants and say, look, I can create something here. Where maybe we do your stable follow-ups for prostate, for example. So one of my biggest key things is to try and inspire. And if you're keen, if you want advice or support in any way, just from my experience, you're always welcome to contact me. Normally the handles I pick up is Dr. Lavan, DoctorLavan, which is my Instagram handle, but I'm also on LinkedIn as well. And both of those avenues, I'm more than happy for anyone to reach out. And if they're kind of feeling a little bit disheartened just with the current situation with the NHS, or feeling to move on to places like Dubai and Australia, which I'm not saying don't go. Of course, it's an experience in itself and it's a learning, but don't give up that there isn't hope there. I know the difficulties of junior doctors at this stage, but as you go through that journey, if we break through that part, there's so many opportunities that you can take up that you may change your direction of travel, where you end up maybe doing 1 or 2 days of general practice, but actually 3 days you're doing something else, ADHD clinics, or working for A&E, or working in a pediatric clinic in London privately. And you can really fulfill your life by serving a purpose, still helping people, but actually earning very, very well. But also finding time to doing your mindfulness and well-being, doing your exercises in the morning, and things like that. And then, I do promotional kind of YouTube videos for health. Sometimes I just do that just because I get fed up sending the same text message about cholesterol to patients. I just say, just watch this video because I've done it according to science. So on YouTube as well. But my Instagram and LinkedIn is there for anyone who wants support or advice.
That's it for now. Thank you for watching. As always, if you found value in this video, please do like, share and subscribe. There are lots more videos in the playlist, so why not continue watching by clicking the Just What Can a GP Do playlist. I will see you in the next one.